You take a seed, you plant it, you grow it, you dry it, you roll it, you smoke it, and it goes down smooth. Hey!
Spanning the globe to bring you the latest developments in medical cannabis, adult marijuana, industrial hemp, and spiritual ganja.
We love the herb.
It's time for the Marijuana Agenda with Russ Belville. Now, here's your host, Russ Belville.
Good day, tokers and tokettes and non-toking lovers of liberty. It is Monday, August 14th, 2017, and it's got to be 420 somewhere in the world. Welcome to the program, and before we get to the marijuana news, a quick note about this weekend's horrendous Nazi terrorist attack on domestic soil in Charlottesville, Virginia. A woman was killed, 19 injured when a Nazi, a white supremacist, ran his car into a group of protesters walking down the street. And I want to make something perfectly clear to the listeners and the readers that follow me. I'm against Nazis. I'm anti-Nazi. So if I find you on the Facebook page or the Twitter feed or throughout the rest of the podcast comments or the YouTube page and you're defending these people in any way or trying to equivocate between them and other groups that are fighting Nazis, please unsubscribe. Please go away. Please stop following me. Don't make me have to take the time to ban you and block you and publicly shame you, because my grandfather fought in World War II to defeat the Nazis, and I won't hesitate to do everything in my power to make sure that sort of ideology does not spread. So there you have it. All right, let's get to the show. On today's program in the Cannabis Headline News, we've got news coming out of the FDA, which has kind of offered up a internally oxymoronic statement on cannabidiol for the World Health Organization. We'll get to that. Also on the show today, we got a visit for our patient-focused update from Americans for Safe Access. The Chief Science Officer, Dr. Jahan Marcu, is joining us to discuss cannabinoid education. You know, just about 13% of doctors ever hear of the endocannabinoid system. Well, the Massachusetts Medical Society has endorsed the idea of cannabinoid education, and Dr. Jahan Marcu is joining us to tell us all about it. And then in the Radical Rant, another profile of Kevin Sabet from Denver's Westward, and I'm going to go through it and show you Kevin Sabet's Achilles heel, the easiest way to trip him up in any discussion about marijuana prohibition, as evidenced by this new article in Denver's Westward. That's all coming up today on the Marijuana Agenda, but first, let's get to the Cannabis Headline News.
This is your Cannabis Headline News, brought to you by MarijuanaMoment.net. The complete source for all your marijuana news in one morning newsletter from Marijuana Majority Founder Tom Angel. Subscribe today for free at MarijuanaMoment.net.
This is your Cannabis Headline News for Monday, August 14th, 2017. I'm Russ Belville. The Food and Drug Administration, in a background document submitted to the World Health Organization, acknowledged the benefit of cannabidiol, or CBD, in the treatment of seizure disorders, while reiterating that CBD is a Schedule I controlled substance considered to have no medical benefit and illegal in all 50 states. Quote, cannabidiol, CBD, is one of the active cannabinoids identified in cannabis, writes Anna K. Abram, Deputy Commissioner for Policy Planning, Legislation, and Analysis for the FDA. CBD has been shown to be beneficial in experimental models of several neurological disorders, including those of seizure and epilepsy. In the United States, CBD-containing products are in human clinical testing in 3 therapeutic areas, but no such products are approved by FDA for marketing for medical purposes in the United States. CBD is a Schedule I controlled substance under the Controlled Substances Act, end quote. Registration in the Montana medical marijuana program has more than doubled since the passage in the 2016 election of an initiative that increased access for patients. There were 17,819 people enrolled in the program as of July, according to data from the Montana Department of Public Health and Human Services. That's up from 9,666 in January and as few as 7,558 in November of 2016. Montana passed medical marijuana in 2004, and the registry swelled to more than 30,000 patients by 2011. Legislators, responding to what they believe to be abuse of the system, passed restrictive new laws, notably one that reduced the number of patients a caregiver could service to just 3, thereby eliminating the state's ad hoc medical marijuana dispensary system. In the 2016 election, voters overwhelmingly rejected the restrictions by repealing the 3-patient limit and explicitly allowing for retail dispensaries, as well as adding post-traumatic stress as a qualifying condition. The Oregon Liquor Control Commission has issued a clarification on naming regulations for cannabis sold in the state's retail locations. OLCC writes, quote, "A label cannot contain any words that refer to products that are commonly associated with minors, marketed by minors, or any names that are false or misleading," end quote. Included in the ban are, quote, "names of children's toys or any character or other item in a children's book, TV show, or movie, like Incredible Hulk, Ewok, Optimus Prime, and Lightsaber, food products marketed to or by children, like any Girl Scout cookie, Thin Mints, Do-si-dos, etc., Frosted Flakes, Lucky Charms, and Skittles, and false or misleading names such as Green Crack, Opium, and Special K," end quote. Ironically, under these regulations, Charlotte's Web, the high cannabidiol strain that's helped innumerable children, will have to be renamed to not appeal to children, even though it was named after Charlotte Figi, the epileptic child Dr. Sanjay Gupta featured in CNN's documentary about medical marijuana, not the award-winning children's book. Speaking of CNN, they are distributing a report on a study about accidental marijuana ingestions by children in France that misleads readers about the danger. The study claims that over a 10-year period in France, accidental marijuana ingestion increased by 133%. It isn't until deep in the report that CNN notes there were just 235 children who accidentally ingested marijuana in those 10 years between 2004 and 2014, working out to fewer than 2 per month. While CNN repeatedly stresses the danger of children falling into comas due to marijuana exposure, something that happened to 32 children, it isn't until much later in the story that CNN quotes the lead researcher as explaining that, quote, "The best way to decrease the number of pediatric marijuana intoxications in France is to decrease the concentration of THC in cannabis through regulation," end quote. A new study is showing that legalization of marijuana in Colorado is doing a better job of keeping weed out of the hands of kids than alcohol. The study, published in the Journal of Studies on Alcohol and Drugs, was conducted by using underage-appearing adults who attempted to purchase marijuana at 20 different Colorado pot shops. The authors note that, quote, "all outlets asked the buyer to show an ID, and only one outlet was willing to sell marijuana to the pseudo-underage buyer. Compliance laws restricting marijuana sales to individuals aged 21 years or older with a valid ID was extremely high and possibly higher than compliance with restrictions on alcohol sales," end quote. This has been your Cannabis Headline News for Monday, August 14th, 2017.
You're listening to the Marijuana Agenda with Russ Belville.
Looking for the 420 friendliest way to visit beautiful legal Potland, Oregon?
I'm Lori Duckworth, inviting you to come stay with us at Delta 9 House and Studios.
You get your own private room with queen bed and access to our high-speed Wi-Fi, premium entertainment system, and more.
We'll even cook you breakfast. Look us up on Facebook at Delta 9 House.
That's facebook.com/Delta9House. Delta 9 House is booked through Airbnb.com. City of Portland permit number 17-159855.
You're not high. You're listening to the Marijuana Agenda with Russ Belville.
We need to say, as Nancy Reagan said, just say no. Don't do it. There's no excuse for this.
Okay, maybe you're a little high.
If you work in the cannabis industry, consume marijuana, or just support freedom, you need to know about breaking policy news that affects you. Marijuana Moment is the daily newsletter that helps you stay on top of all the latest and most important state, federal, and international cannabis developments. Brought to you by longtime legalization activist Tom Angel, Marijuana Moment puts a concise yet comprehensive overview of cannabis news in your inbox early every weekday morning. Wake up to Marijuana Moment and rest assured you'll be ready for the cannabis news that's driving the day. Subscribe now at marijuanamoment.net. Welcome to ACE's Patient-Focused Update. Almost every U.S. state now recognizes some form of cannabis as medicine. But since 1971, the federal government has steadfastly denied the medical benefits of herbal cannabis. Americans for Safe Access is the nation's leading organization fighting for the rights of all patients who use cannabis as medicine. Join us now for another edition of ACE's Patient-Focused Update. Welcome, everyone, to another edition of the patient-focused update with Americans for Safe Access. I'm Russ Belville, and joining us is the Chief Science Officer for Americans for Safe Access, Dr. Jahan Marcu. Jahan, welcome back to the show.
Thank you.
You know, we're really excited about what Americans for Safe Access is doing with respect to education and certification. For so long, we've had medical marijuana that's kind of run in a hodgepodge of different state and even county level regulations. But now Americans for Safe Access is working to help bring cannabis education to the people, bring patient-focused certification to our outlets, and we really appreciate you doing that. I was wondering if you could give us an update on what's happening with cannabis education. I know last time we talked, you were talking about different universities that were getting involved with this and pushing toward the patient-focused certification. What's new with respect to cannabis education and Americans for Safe Access?
And that's absolutely right, Russ. You know, the training and education for cannabis is a moving target. And we're seeing different societies, different organizations coming out in stronger support. Whether or not they're in favor of someone using cannabis as a medicine, we still see people on both sides coming together and saying, you know what, everyone needs to be educated. And surprisingly, over the last month, the Massachusetts Medical Society, which is a leader in continuing medical education, the CME that doctors have to take every year, they're a global provider of this type of education. They're now endorsing the answerpage.com, which has a comprehensive cannabis curriculum. And one of the ways you can answer the Harvard-based AnswerPage cannabis curriculum is through Safe Access's site called Cannabis Care Certification. And the Cannabis Care Certification has both the doctor education, but also patient and caregiver education and legal requirements in those states. So you can go to Cannabis Care Certification right now, sign up for CME if you're a doctor, or if you're a patient and caregiver, get patient and caregiver education, videos with learning objectives, as well as look up your requirements for becoming a patient, maintaining your registration as a patient, and perhaps how to get your doctor registered in different states. And the answer page that now has this cannabis curriculum, they were actually founded back in 1988 by two pain specialists, and in 2012 they actually started to work on medical cannabis education because the founders were a husband and wife, the Dr. Stephen and Meredith Korn, and their son was asking questions about cannabis that neither one of them could answer. And so they realized that if they can't answer a 10-year-old's basic questions about medical cannabis, that there are probably other doctors who are struggling to answer questions to their patients. And so, what's interesting is that I just want to be clear that the Massachusetts Medical Society does not endorse the use of medical marijuana. But by adopting this curriculum, the society is acknowledging how important it is that doctors be informed about cannabis and ready to answer any and all questions their patients have. I think if you want to be that reliable source of information as a physician to your patient, regardless of how you feel personally about cannabis or professionally, you still need to be able to answer the questions objectively and with the latest science. And Dr. Henry Dorkin, the president of the Massachusetts Medical Society, said in a statement, quote, "With legalization of both medical marijuana and recreational marijuana growing in states across the U.S., it is imperative that physicians be prepared to answer questions about marijuana use and to counsel their patients about any potential impact of cannabis." That's the Massachusetts Medical Society. And, I think that's the same thing when it comes to anything about standards or education. Everyone wants the same thing. Everyone wants people to be in optimal health and for things to be safe. And so I think it's great to see on both sides of the issue, people coming together about, yes, operations and businesses need to be certified, employees need to be trained, doctors need to be trained. Even if the doctors do not write recommendations for medical marijuana or have no plans to, it's still imperative that they know what information is out there. Dr. Korn has this really great quote that's out there in the media. The founder of the Answer Page and one of the administrators for their cannabis curriculum basically said whether or not doctors or other healthcare providers and professionals have any intention of recommending medical cannabis for patient care, they all need to be well educated in this clinical area because their patients will be seeking their expert advice and guidance for this medication. Further, some patients may already be utilizing medical cannabis, and doctors and other healthcare providers will need to be aware of the physiological effects of cannabis as well as potential drug interactions and side effects. As such, expertise in medical cannabis will be necessary for most doctors, pharmacists, nurses, and other healthcare professionals. I think what's important to point out here is that what they're talking about is that it's necessary for most doctors, not just doctors who are recommending cannabis or working with medical cannabis patients, but all health professionals need to be ready to continue to be the constant source of good and reliable information for their patients.
And speaking of that information, in the past, thinking back to, Jeff Sessions' halcyon days of the 1980s when we were saying just say no, what about the quality of the information itself? Some might worry that these doctors are going to be referred to a site or a source that tells reefer madness lies about cannabis. Can you vouch for the information they're getting?
So that is also very important. And this isn't just a blog that's posted up where anyone can post. This isn't a Wikipedia of medical cannabis training. This is a peer-reviewed process. So you have subject matter experts, say pain experts or other experts. Right now, for example, there are over 20 courses. You could take it on Lou Gehrig's disease. You could take it on chronic pain. You could take a CME on the federal and state regulations. You can take it on multiple sclerosis, cancer and chemotherapy, HIV/AIDS. All these topics are there. How did they get there? Subject matter experts were contacted. For example, I know one clinician the clinicians who have run medical cannabis studies were invited to write specific things, and so these things are submitted and reviewed by an accreditation body, such as Harvard University or other accreditation bodies that do the third-party assessment. And so all the material had to be vetted by medical experts. And again, this is the answer page is an online doctor education site that is Harvard-based. And so the same standards that go to information coming out of Harvard is what is being applied to these trainings. So it's very much removing any potential bias. Even if the author who wrote it only studied therapeutic use of cannabis in human populations, it was vetted by other people. And I think that's the peer review process, and not only the peer review process, but it's also done by experts, is a very important component. And so this material is very objective. It's based in science, and it's not a political, it's non-political. We're not politicizing or commercializing the science here. We're talking about this is what is known, and this is what is not known, and this is what you can say. And so we know how cannabis works generally in the brain. We know that it inhibits the transmission of certain neurochemicals, which can decrease pain transmission. Like the mechanisms are known, well established, can be taught. There's lots of information that is demonstrated to be representable. Now, there's a lot of research that hasn't been conducted that needs to be done, but due to the safety of cannabis, and that's been studied to death, and some people refer to safety studies on cannabis as drug abuse studies, but they're really informative because drug abuse studies have shown us the millions and millions and millions that have been poured into it, that it has a lot of therapeutic potential and is safer when compared side by side with other medications in terms of toxicity, overdose, and damage to the liver and things like that. And so we have a lot of information, a lot of what we call phase 1 information about the general safety across many different types of patients consuming cannabis either through oral or an inhalation. And so we are awash with anecdotal reports about the safety of cannabis. There's tons of those coming out of Israel. I had 3 patients. They responded well. These aren't hard, fast clinical studies. But there have been clinical studies going on in the U.S. I think the U.S., if you take all of the published anecdotal reports and some of the clinical studies that have been done here, there are over 300 that are reported. Now, they're of different quality. And so you don't want to include all anecdotal reports into the training. And so some of that stuff had to be vetted and whittled down to see what was reproducible, what had the proper controls, or, as the best of their ability. And so what you're going to find through the answer page in the Cannabis Care Certification site of ASA is information that is accredited by institutions that are recognized around the world. And the information is objective, and so that appeals to people who may be deeply involved in cannabis, like such as physicians who are writing recommendations, treating patients, or perhaps it's physicians who just have a lot of patients coming to them about cannabis. Maybe they're a pain specialist and they have a lot of patients who are taking medications and using cannabis as well.
And Jahan, I was wondering if you could also give us the website that people could directly access this care information you're talking about.
If you go to cannabiscarecertification.org right now, you can sign up for either the medical professional training, over 20 CME accredited hours, as well as sign up for patient or caregiver education. And you can also look up the requirements for your state if you're a patient. If you want to become a patient in Maryland, or you want to become a patient in Pennsylvania or Nevada, you can look up those requirements and also download any relevant applications you need for the state program. So Cannabis Care Certification, your education resource for medical professionals, patients, and caregivers.
Thanks, Jahan. Appreciate it very much. And we'll talk to you again on another episode of the Patient Focus Certification.
All right. Thank you.
This episode was produced as part of the Marijuana Agenda with Russ Belville, the daily news and interview podcast covering the world of medical cannabis, adult marijuana, industrial hemp, and spiritual ganja. MJAgenda.com.
Hi, I'm Russ Belville from the Marijuana Agenda. If you're a cannabis brand looking to build trust and awareness within the community, consider becoming a sponsor of this program. Your message will be seen and heard by the most dedicated followers of marijuana policy reform, who are loyal and supportive of those brands that give back to the community. Just log on to mjagenda.com and click the Become a Patron button to learn how your brand can also be featured in my live nationwide appearances. Thank you for your support.
The Marijuana Agenda, like the alcohol agenda. But a lot safer.
The Marijuana Agenda with Russ Belville is proudly sponsored by the Marijuana Business Association. The MJBA, called by NBC News the Cannabis Chamber of Commerce, is the fastest growing business association and the fastest growing industry in America. I've been working with the MJBA for years, and I personally invite you to join the MJBA. MJBA also publishes the popular MJ Headline News on Facebook and the MJNewsNetwork.com and Marijuana Channel 1 on YouTube. Visit mjba.net for more details.
Total war against public enemy number one.
10 federal criminal penalties for 1 ounce of marijuana.
Marijuana is probably the most dangerous drug.
Just say no.
Legalization is just another word for surrender.
I experimented with marijuana and didn't inhale.
This is not medicine. This is a Cheech and Chong show.
Encourage people to use less drugs.
I am ill.
That was the point.
I think it would be a mistake to legalize.
Negative reports coming out of Colorado.
People don't smoke marijuana.
There's a profile of the Joker to my Batman, Kevin Sabet, in the latest edition of Denver's Westward, their alt-weekly paper, and it's full of the typical Kevin Sabet bullshit, trying to paint himself as the kinder, gentler drug warrior. But I just wanted to focus on one particular passage within this piece, because it illustrates Kevin Sabet's Achilles heel when it comes to debates of marijuana legalization. Let me just read. This is from Kevin Sabet. Quote, "Also, we don't want to see a return to an enforcement-heavy policy that throws everybody behind bars or saddles young people, especially, with criminal records that prevent them from getting a job or being able to access public benefits or being able to go to school. We want to see people given another chance, but we also want to see this treated as a health issue, and you don't treat marijuana as a health issue by ignoring it or facilitating its use. You do brief interventions if they're needed, treatment if it's needed. I don't think everyone who uses marijuana needs treatment, just like everyone who drinks drinks or uses other drugs doesn't need treatment. But some people are using it in a way that is problematic, and they need an early intervention, perhaps, to prevent them from moving on to a substance use disorder, or they need more intense treatment. It really just depends." End quote. So I just wanted to talk about this because it's interesting to me that Kevin Sabet thinks that we don't all need treatment, that some of us are non-problematic marijuana users. So my question is, how do you determine which one of us are the non-problematic ones? He says you do brief interventions if they're needed, treatment if it's needed. I don't think everyone who uses marijuana needs treatment. Well, how are we determining the people that do or do not need treatment? Well, the way that's implied here is that you keep marijuana illegal. Now, he says he doesn't want to see criminal records, so that implies decriminalization. So under decriminalization, what that means is someone who has marijuana on their person is subject to a search by the cops, is subject to a fine by the cops. Is it Kevin Sabet's idea that anyone who gets caught is someone who's got a problematic use of marijuana? That's what defines it as a problem, merely getting caught with it? The only people that won't be subjected to these interventions and treatments would be the ones who don't get caught, right? But here's the Achilles heel. To get to the actual Achilles heel of his reasoning in here is the fact that he's given us this gift. He says there are non-problematic cannabis users. He has admitted in this statement that, like people who drink, there can be people who use it who have absolutely no problem with it. So, Kevin, where do we buy it? That's the Achilles heel, folks. The marijuana market. Where do we buy it? If I'm a non-problematic cannabis user, the kind that you say not everyone needs treatment, not everyone needs intervention, some of us are non-problematic, where do I buy it? Where do I go get it? The only problem in that situation for the non-problematic cannabis user is having to become a criminal and interface with a criminal market in order to be that non-problematic cannabis user. And of course, Kevin Sabet's Project Sam recommends that the crimes of distributing and manufacturing and selling marijuana remain felonies and misdemeanors. That's right from their website, remain felonies and misdemeanors. So he's not got a problem with the marijuana consumer so long as the marijuana consumer doesn't get caught, and that marijuana consumer then has to go and feed an underground market, an illegal market, 100% of a market that doesn't pay any taxes whatsoever. And that market will still be subject to raids and seizures and arrests and imprisonment that drives the price of marijuana up to a level far higher than it would naturally be, which leads us cannabis consumers to be supporting criminal activity, supporting this underground market. That's the problem with prohibition. It's not whether or not marijuana is safe or marijuana is harmful, or it's more or less harmful or more or less safe than alcohol or tobacco or prescription drugs. It's that you can't repeal the law of supply and demand. That there is a thing called marijuana that plenty of people like. And also in this article, he goes on to talk about alcohol and how we can't ban alcohol. We tried to ban alcohol. It didn't work because it's been around for millennia. This is the old culture war argument. It's been around for millennia and people accept its dangers. They accept it, and 50 to 60% of the people drink, and there's no way you can stop 50, 60% of the population from doing something, but only around 10% of the people smoke marijuana, so it's not too late. That's another gift from Kevin Sabet. He admits this is a culture war. He admits he's not willing to go after the more harmful substance in every objective manner. He's not willing to attack that because they're too politically powerful. They're too big. So not only is Kevin Sabet a hypocrite, he's a bully. He decided, well, let me find the smallest group of people that I can pick on that don't have enough power. That's what that's all about. You're not fooling anyone, Kevin. You're the same prude, hall monitor type kid that formed Students for a Drug-Free Berkeley. You're upset that you didn't get in with the popular kids. Stop trying to criminalize those of us who are far less harm to society than beer drinkers.
Follow MJ Agenda on Facebook, Pinterest, Instagram, YouTube, and follow MJ Agenda Show on Twitter. Learn more at mjagenda.com.
That's all the time we got for today. Join us tomorrow for the Marijuana Agenda. For everyone here at Delta 9 House and Studios, I'm Radical Russ. Until next time, take care of each other, tokers.
You roll it, you smoke it. You take a seed, you plant it, you grow it, you dry it, you roll it, you smoke it, and it goes down smooth.